Coronary angiography prior to surgery for valvular heart disease is considered for those 40 years and above if there are no coronary risk factors, and for those 35 years and above when there are coronary risk factors. Screening coronary angiography is usual prior to surgery for valvular heart disease in older individuals, even though most of these diagnostic coronary angiograms turn out to be normal. This is done because clinical ECG, echo and radionuclide studies are not very specific for detection of coronary artery disease in the presence of severe valvular heart disease. Please subscribe to this channel for future updates. Click on the subscribe button. Press the bell icon after that for all updates. Moreover, long-term outcome is better if those with significant associated coronary artery disease undergo coronary artery bypass grafting in addition to valvular surgery. Untitled and colleagues in a retrospective analysis of over 1,000 patients found about 11% prevalence of significant CAD in those undergoing surgery for rheumatic valvular heart disease. They noted that those with associated CAD were older than those without CAD, with a mean age of around 55 years versus 51 years. Conventional risk factors like hypertension, diabetes mellitus, dyslipidemia and smoking were seen in those with significant CAD. Among the valvular lesions, aortic stenosis was associated with CAD with an odds ratio of 1.66, while aortic regurgitation was inversely associated with an odds ratio of 0.56. A similar 11% incidence of CAD in about 2,200 patients with rheumatic heart disease was documented by Narang and associates as well. They also noted that there is correlation between aortic stenosis and CAD and an inverse correlation between aortic regurgitation and CAD. These authors suggested a cutoff age of 40 years in males and 55 years in females for screening coronary angiography prior to surgery for valvular heart disease. Multislice CT coronary angiography has been shown to have a high negative predictive value for excluding significant CAD. Betancourt and colleagues prospectively evaluated around 450 pre-surgical patients with valvular heart disease. They concluded that calcium screening is useful prior to CT coronary angiography to detect those likely to have positive and inconclusive results on CT angiography. Such patients can be directly referred to invasive coronary angiography. This approach would reduce the radiation risk as calcium screening carries lesser radiation risk than CT coronary angiography. Those deemed likely to have negative CT angiograms by calcium screening can proceed with CT angiography as it is less invasive and still has a high negative predictive value. Here are the references on coronary angiography prior to surgery for valvular heart disease. Please don't forget to subscribe to this channel for future updates and click on the bell icon for all updates. Thank you.